While it is a usual afternoon in the heart of a small South Indian city, Tiruchirappalli or Trichy, there is something unusual about the ongoings of the day here. The women of the city are on their way to a special gathering planned for the day. They are on their way to the monthly meeting of She Leaders. These are no ordinary women. These women are leaders of the She team in Trichy. They are ambassadors of change in slums. Formed with the support of Gramalaya, these sanitation and hygiene education or She teams have been facility managers of the community toilets in slums since the year 2000. It's because of them that these slums have become free of open defecation, and the residents have truly understood the importance of sanitation. With the involvement of the community, Trichy has gone from being one of the least sanitary cities of India to one of the cleanest.
Being a She team member has made me much more independent and more confident.
It makes me feel proud to help in the development of my community.
We are ready to pay money if toilets are maintained so well.
Girls are no longer scared and they feel safe.
Located in the southern state of Tamil Nadu, Tiruchirappalli, or popularly called as Trichy, is the fourth largest city of the state. The city greets you with the sounds of temple bells and exquisitely sculpted temples and fortresses, including the famous Srirangam and Jambukeshwar temples. Home to almost 8.5 lakh people, the city receives an influx of 25,000 to 40,000 pilgrims annually. Every fourth person of Trichy lives in a slum. The city has 286 slums spread across the city. Meet Gomathi Amma. She has been living in Veragapatti slum since last 15 years.
I got married 15 years ago and moved to this area. Earlier, me and my daughter had to go to defecate late at night or in the evening. It was very difficult for both of us. Now, SHGs has built and is maintaining the toilets. Now we can easily go to the toilet multiple number of times, even with my daughter. Since we can go to the toilet at the right time, our health has also improved considerably. Since the place is free from flies, we no longer have any disease.
With the technical support of several NGOs such as Gramalaya, Scope, Sevai, Ex-Nora International, and with financial support of Water Aid, the city embarked on a journey to turn around this situation.
And we have taken up 8 slums in the Trichy City Corporation as our model slum, where we have initiated hygiene education programs among the women, children, and also working with the local elected representatives as well as the city corporation officials.
Interactions with women residents reveal that sanitation was a huge challenge that they faced every single day. They were also not aware whom to approach to improve the existing conditions. The municipal corporation has constructed numerous community toilets but could not maintain them. These soon became dysfunctional and dilapidated. Thus, Gramalaya started engaging with women in the slums. What started as an awareness drive transformed into the women organizing themselves and taking charge of maintenance of these community toilets. The project had 4 main components: gathering information of the existing situation, trainings, organization of committees for toilet management, toilets construction or reconstruction. A baseline survey and focus group discussions helped understand the existing conditions in slum areas. Field teams were organized to gather information on the location of community toilets, open defecation practices, and issues and needs of slum dwellers. Today, there are 450 self-help groups representing 186 slums in the city. Each slum typically has 2 to 5 self-help groups. 2 members from each self-help group are nominated as She Team leaders for the particular slum. There are 90 She Teams at the city level. These self-help groups are the facility managers of the community toilets in their area, and they collect user fees from the community. The She Teams are responsible for awareness campaigns and one-to-one communication with slum residents in their slum. They maintain the accounts of money collected and manage disbursements. These She Team leaders come together at the city level as a federation known as Women's Action for Village Empowerment, or WAVE. Led by a president and a committee, WAVE guides the She Teams in maintenance of community toilets. It also assists other self-help groups to take over maintenance of community toilets.
I am a She Team leader for Kalumandai area. I am also the leader for SHG Alaigal Kuttamaipu. Under our She Team, we have 90 toilets and we are maintaining them. We are doing this since the year 2000.
Currently, 90 community toilets in the corporation are operated and maintained on a pay-and-use basis by these self-help groups. The Trichy Municipal Corporation also constructed toilets as per the design inputs of WAVE.
One of the self-help group members suggested, sir, we should also provide toilets for the children in the slums. Because children won't be able to get inside the toilet and lock the room, they will normally hesitate to use such a toilet facilities. Then they will go for open defecation in the drainage or in their nearby houses. Then we also designed, along with the community members' input, the child-friendly toilet.
I live in Kalamandai area. Earlier we used to defecate in the open. Now we have a toilet and we use it.
The Trichy Municipal Corporation is responsible for provision of water supply, drainage and electricity to these facilities. The annual taxes and charges are borne by the self-help groups through user fees collected. Slum residents have to pay for each use. A user has to pay 50 paise for defecation and 2 to 3 rupees for bathing and washing clothes. Use by children, single women and the elderly is totally free. On an average, a family of 5 pays about rupees 150 to 250 per month. If families are unable to pay, they can pay a monthly charge of rupees 50 per family per month. Each family is provided with a card as a receipt for the monthly fee. The family member can access the toilets and bathing facilities after showing the card to the toilet caretaker.
My name Bhanupriya.
I'm working as a toilet caretaker. I take money from users and give coupons. Only women work as toilet caretakers round the clock. That's why all women feel safe to use the toilet at any time of the day. I work here for an 8-hour shift. I earn rupees 100 per day.
Earlier, we did not have good toilets in this area. We had to go out late at night or early in the morning for defecation. It was scary for us at night. But since these toilets have been built, it has been very useful for us. Girls are no longer scared and they feel safe.
Earlier, these toilets were in a very bad condition. They were damaged and dirty. Now the SCG members are managing and taking care of the toilets. After repair work was undertaken, we started using these toilets. They do not ask us for money. We are ready to pay money ourselves. We are ready to pay money if toilets are maintained so well. Not just focusing on the women residents, there was a need felt to engage with men from these slums as well. Separate associations for water, sanitation and hygiene, or WASH committees comprising of both men and women have been formed. These committees mainly liaison with the municipal corporation for improvement of services. Along with improved toilets, this has resulted in a massive empowerment of women. Although many of these women were previously involved in savings and credit activities, their exposure to the public sphere was limited. Now, each She Team has opened a bank account to deposit funds collected from the community. At the month end, She team reports the expense details of the group at the monthly WAVE meeting. Thus, the movement has empowered women at two levels. The initiative has addressed the issue of treating women as users of clean and properly maintained sanitation facilities. Secondly, for the first time, there has been a shift of women's status from homemakers to key decision makers in the community.
The money collected for this is not used for any personal use. We are using this money for buying cleaning materials, paying wages for the cleaners. We also got 2 bank passbooks and are saving excess money in bank for buying cleaning materials, paying wages, fixing bikes used for this service, repairing motors, etc. Now, because of this, there is no hospital expense for anyone. Not just in our area, we are now giving training to newly formed SHGs in other areas too. We are planning to expand this throughout Trichy.
I opened a bank account for the first time after becoming a She team member. I now feel comfortable to operate a bank account. Earlier, I was mostly doing household chores. Nowadays, as a She team member, I am also enthusiastic for development of my community. It makes me feel proud to help in the development of my community.
Initially, the program was financed with the help of water aid and other donors. These self-help group-managed toilets were soon cost-efficient and unburdened the municipal corporation of important investment of construction and maintenance. The income created by the pay-and-use system of the toilets is sufficient for maintenance of these toilets.
So, this much of tremendous changes occurred due to the slum involvement only, slum dwellers involvement with the self-help group. So, basically self-help group involvement and the NGOs cooperation, departmental support, these are all the things to eradicate the open defecation. Previous open defecation places were completely eradicated.
Looking at the success of the initiative, the Trichy Municipal Corporation has taken a step forward. The corporation has built a biogas plant and community kitchen within the premises of the community toilet complex at Viragapatti slum. The plant uses wet waste from the slums and the fecal waste for generating biogas. Women are then able to make use of the biogas to cook in the community kitchen. The management of the plant and the kitchen will soon be handed over to the self-help group managing the community toilet. The Trichy model of community-managed toilets with bathing and washing facilities is an example of a partnership between city authorities, communities and NGOs working together to address problems of sanitation. The movement has now gathered pace and spread like fire amongst the entire community. The community members now associate the usage of toilets to dignity. They no longer need to barter their self-respect with the necessities of life. What started as a fight for dignity has now brought them health and economic well-being and a sense of safety too.
जागू उठेंगे भाग्य हमारे, सच बनेगा ये भारत। जागू उठेंगे